Hello everyone, my name is Dr. Aubrey Tager. I am a doctor of natural medicine. I'm a naturopath and I practice in Pointe Claire, the west end of Montreal. And today what I want to talk to you about are traumatic brain injuries. Traumatic brain injuries, specifically mild traumatic brain injuries, are also what we know as concussions. So a little bit about myself. I am a doctor of natural medicine, as I said. I also am a diplomate of the American Board of Integrative Medicine. I'm board certified in integrative medicine. I am a naturopath with l'Association des naturopathes professionnels du Québec. I also have a certificate from the American Functional Neurology Institute. I am also currently going through a fellowship with the International Association of Functional Neurology seminars, which is a 2-year fellowship in functional neurology. I'm also the author of an upcoming book called Under Attack: How an Autoimmune Condition May Be Sabotaging Your Health, and that should be out shortly. So a little introduction. In the next several minutes, what I'm going to be doing is I'm going to be going over some important information that may help those who have suffered from a concussion and who are looking for some answers. When somebody suffers a concussion, it's not just them that suffers, it's going to be the entire family. It's the parents, it's the siblings, everybody around them, teachers, everybody suffers as well. So let's look at some concussion facts. 1.7 million people a year sustain a traumatic brain injury or a concussion each year in the United States. Okay? One of the main problems that we see is that people really aren't given enough time in order to allow their body to heal. They're pushed back out, they're pushed back into games, they're pushed back into sporting events or into school without actually having that part of the brain that's been affected heal. They're not given enough time to heal. So some more statistics associated with that. 52,000 die a year as a result of concussions. 250,000 people a year are hospitalized, and 1.3 million are seen in the emergency room and are released. Now these are statistics from the United States and not from Canada. So what is a concussion? Well, like I said, a mild traumatic brain injury, and this follows an impact to the head or excessive movement of the neck forward and backward or side to side. Now let's look at the biomechanics of the brain. Now, the brain is a free-floating gelatinous substance, so it doesn't mean it's made of jello, but it's very, very close in its consistency. I have a small little brain here. So the brain itself, what it does is it's actually going to move around, and it's going to move forward, it's going to move sideways, it's going to rotate, and it's going to be doing this as it's sitting on a pole. Okay? So imagine that your brain stem is the stalk or pole that this sits and rotates on. Okay, so when you are hit, the brain is going to move around side to side, back and forth, and it can hit the inside part of the skull, and that is very, very hard. Okay, now the brain stem itself is where your vestibular system is the part of your nervous system that actually deals with balance and coordination. So if this is being affected, if the brainstem is being affected, you can see how that may cause a problem as well when somebody is suffering from a concussion. On the metabolic side of it, okay, so this is not just dealing with the brain, but it's dealing with your endocrine system, your hormones. So the pituitary stalk, this small little piece called the pituitary stalk, anchors the brain, the brainstem, and as the brain slides, it's going to damage, or it can damage or bruise that pituitary stalk and the associated structures that are along with that. And this is where we find the conduction or the housing connection, or the housing for things like hormones going down to your thyroid and also the adrenals. Okay, so it's very, very important that we look at that when you do sustain a traumatic brain injury. So what does this cause? Well, first and foremost, what it does is it causes a decrease in energy. You also can end up having hormonal problems. You can end up having vestibular or balance problems associated with that too. And you can have brain problems all rolled into one. So it's no wonder that when people suffer from a traumatic brain injury, that they're having all of these different feelings all at the same time. So when we look at the metabolic side of concussions, we see a massive release of what's called glutamate and aspartate. Okay? This overstimulates certain kinds of receptors that you have called glutamate receptors. And what this does is this results of an influx of too much moving in of sodium and of calcium. And this leads to cell death or toxicity, neuronal toxicity. The cells can't handle all this. So the cells are being extremely affected. And when we're talking about the cells, we're talking about the cells in your brain. Okay? Now, concussions in young athletes. Student athletes are much more prone to complications in high school rather than in college. The reason for this is because they are growing. Okay? So they're going through all of these different hormonal changes, and all of these things can be affected. The brain is growing as well. What we start to see with certain athletes, female soccer players, they start to get more concussions because there is a correlation that we see between neck strength itself and the size or incidence of a concussion. We also don't seem to see as many concussions in certain sports like rugby because they're not using their head or their body as a weapon. Helmet technology. So when we look at certain sports like football or hockey, helmets are going to stop or reduce the skull from being fractured. But this is not going to stop a concussion. The new technology that's coming out, all of this is great, but it's not going to stop the movements of the brain inside the skull. They are trying to do some things with technology in order to try and help that. But we're not quite there yet as far as the technology goes. So right now, as it stands, the only thing that a helmet is going to do is it's going to prevent an actual fracture of the skull. Now, 50% of all concussions occur in football. Rugby, as I said, has the least amount of concussions in terms of the actual injuries that go on because they don't use their heads as a weapon. Now, when we're talking about delivering a hit, those that actually deliver the hit generally have less symptomatology than those that are receiving the blow because they're ready for it. They're loading themselves up. That's not to say that they're not going to be injured. There have been many athletes, and I have seen them. I was just watching a case this weekend where an athlete was trying to hit harder. He was a football player, a young football player in the US, and he figured he would put his head down, and he became a quadriplegic and later died. But he thought that if you're going to put your head into it, then you're going to be able to hit harder. So initial stages of a concussion. So what we first start to see is corticopontine dysregulation. So this is a part of the brain that we're dealing with the cortex and the pons, corticopontine dysregulation. And then we start to see a breakdown of the blood-brain barrier. The brain itself does not have any receptors for pain, okay? But the coverings around them, the meninges, the actual blood-brain barrier, there are receptors there, different kinds of receptors. And we also have a barrier that does not allow for things to get in, so you don't get infections. When you have a concussion, that blood-brain barrier opens and things are able to get in and things are able to get out. So you have a swelling of the brain. You also have cellular damage. So the cells themselves on a cellular level are damaged. We get a decrease in vasculature. This is extremely important, by 30% in the first 48 hours. That's what we call vasoconstriction. So the blood vessels are actually going to constrict, and that's going to limit the amount of blood flow that is going from the heart up to the brain. And the brain needs blood. So inflammation is occurring. It is initially, in the first stages, it is a good thing. We want to have inflammation. We can't just think of inflammation as a terrible thing. But once we get to a certain point, we want to stop that inflammation, because if inflammation continues, then that is going to give us problems. But initially what we have to do is we have to have that inflammatory process in order to clean out the debris, the damaged cells, the dead cells, so that you can repair and have new ones. So a little bit about brain anatomy and physiology. In the brain we have what's called oligodendrocytes. So oligodendrocytes are the covering for the nerves in order for the nerves to have conduction, in order for them to communicate with another nerve. The astrocytes, so astrocytes are a certain kind of nerve, it opens the blood-brain barrier. And then another kind called microglial cells are going to eliminate, they're going to get rid of the bad or the dead neurons. Now another thing that happens is we end up having what's called tumor necrosis factor. So this starts to be made as soon as your head gets hit. So tumor necrosis factor, what it's going to do is it's going to activate these astrocytes, which opens up the blood-brain barrier. Now when that blood-brain barrier is open, anything can come in. So microglial cells, these small cells, microglial, they get activated to get rid of the bad neurons, and this is good, but it makes you susceptible to other things coming in through that open blood-brain barrier. Now your brain only makes one type of cell to get rid of those problems with regards to immunity. They don't have any suppressor or tumor killer cells like in the rest of the body. Glial cells do not shut off from the brain when they start to get going. That's part of the problem. And they can continue until the neurons die off. So what we start to see is a decreased function of what's called the vagus nerve. So your vagus nerve, we therefore start to have problems with motility. Okay? Motility is as you're actually eating food and pushing the food down so that it can get digested through your digestive system and down into your gut where 80% of your immune system is. This can lead to a gastrointestinal problem or gastrointestinal dysfunction or dysregulation. Okay? This occurs along the gut-brain axis. So we have an axis, we actually have this linear line that's going from the gut to the brain, and it's actually going right back down. So gut, brain, gut axis. Okay. So when we start to have problems with the gut-brain axis, we also have problems with the brain stem. And this leads to potential issues with heart rate, blood flow, and also your internal organs, and issues with digestive enzymes, because these are what we call the autonomic regulation, and the autonomic regulation occurs in that part of the nervous system known as the brain stem. Lastly, what we see are problems with the thalamus, okay, the hypothalamus, leading to valve control problems and increased intestinal permeability and more gastrointestinal dysfunction. So you can see now how we actually, when we have a concussion, how we're getting that involvement with the stomach, with the gut, and with our entire metabolic process. So how do you know if you've suffered from a concussion? Well, there are certain symptoms that may be present. Headaches, nausea, irritability, dizziness. You may have sensitivity to noise or sensitivity to light. You may have difficulty falling asleep or staying asleep. You may have double vision or a lack of concentration. So if you're suffering from any of these issues, make sure that it gets evaluated. It's very, very important. The earlier you can get evaluated and get treated, the better the outcome is going to be. So how do you determine if a concussion has occurred? Well, the main thing is to be able to make sure that you don't get to the point where you have suffered multiple concussions or returned too quickly to play or to anything. One of the things that can actually help, especially when dealing with the general public, and we're not talking about healthcare professionals, we're not talking about athletic trainers or physical therapists or physiotherapists, doctors, whether it's MDs, DOs, chiropractors, podiatrists, whatever it may be. We're dealing with the regular population who doesn't understand concussions, anatomy, physiology, or how the brain works. When doing that, there are certain things, like there are sideline tools that may be able to aid people in identifying that this person may be at risk for a concussion. Not that they have suffered a concussion, but they may be at risk. How does a parent who's coaching a hockey team know if this kid that just got hit in the head should go back in and have a chance to play or not? Did they suffer a concussion? Did they not? They don't know. They're not a doctor. So there are certain things. There is a tool called Sway, which is a sideline app tool. It's good specifically for that. It is a tool. It's not a diagnosing thing for healthcare professionals, but it is a sideline tool to help lay people understand that their child may not have gotten to the point where they can return to play. Basically, the way that this works is it's a form of baseline testing. So your child is tested at the beginning, they see where they are, and then after they have sustained or possibly sustained a concussion, it will say they are either ready to go back in or they are not, and now they need to seek medical attention and get a proper diagnosis in the form of an evaluation from a medical professional. So this device actually is an FDA, it's a Health Canada cleared medical device, simple and inexpensive to use. If you want to know more about that, please go to swaymedical.com. I just know the people that deal with it here. I in no way make any money from Sway Medical. It's just a good tool for the average people to be able to aid them. It doesn't aid me in my diagnosis. So, like I said, it allows one to determine a baseline testing. There are other baseline testing available as well. Baseline testing is a good thing to have because what ends up happening is people will ask, how do I know if this is a result of the concussion? How do I know if I was like this before or after? You don't unless you had baseline testing. Okay? So if you have a baseline, it gives you something to compare to what you were like before having a possible concussion. So the objective post-concussion is to rid the brain of all of the bad cells as soon as possible and then close the blood-brain barrier and decrease the response of those microglial cells. Any pre-existing condition, like an autoimmune condition, diabetes, or any other condition like that, is going to make things worse. So it's going to slow down the healing process. Concussions are an expensive thing. They take time, they take money. The total cost is over $76 million a year in the US in treatment and lost wages. So let's take a look again at that brain-gut axis. So that is the connection between the brain and the gut. 80% of our immune system actually lives in the gut. It's made up, like I said, of our stomach, our large and small intestines. Degenerative changes can begin in the gut or they can begin in the brain. They can begin in both. It's not one goes to here. It can happen either or because there's gut-brain, brain-gut axis. It goes back and forth. So motility, the movement of food in the gut-brain axis is an issue, and clinically this can be a neurological problem. Just because it's happening in the gut, just because there are problems there, that doesn't mean the issues are not affecting the brain. So if this axis is not functioning, food can actually ferment in the gut, and it can lead to bacterial or yeast overgrowth. Okay, and when we start to have issues like that, that's when we have to do additional testing. This is when we have to look at additional labs. Are there SIBO, a specific kind of bacterial overgrowth that's going on in the gut? Are there problems with neurotransmitters? Is the person not able to actually absorb or methylate certain types of vitamins? Is methylation a problem? Are there other issues with anemia or blood sugar level dysregulation? So we want to look at all of these once the brain is involved in any kind of injury where it's affecting both the gut and the brain. So traumatic brain injury and autoimmunity. If the brain axis fails, then this itself can lead to autoimmunity. Not just the pre-existing autoimmune condition that may be there, but this can actually lead to an autoimmune condition. An autoimmune condition is what happens when the immune system attacks itself. you lose what's called you have a loss of self-tolerance. So you start to have an increased permeability in the gut, and then the body starts making antibodies towards itself. Now, gluten, GMO, and soy are very immune reactive. Okay, so what they are going to do is gluten itself is going to bind to synapsin, which is a protein that's actually located in the neurons. And as this gluten binds, it actually can look like the gluten itself. It binds also to cerebellar Purkinje cells, so it doesn't really. It looks similar, and the cerebellar, the Purkinje cells are what deal with balance and coordination. So if it starts attacking that part of the cerebellum, then you start to see issues with balance. So the immune system starts to destroy the brain and can cause systemic inflammation as well. So what do we want to do after a concussion? Well, first and foremost, we want to make sure that there are no carbohydrates given to a child or an athlete. It doesn't have to be a child. But the reason why we want to do that is because the brain cannot handle the glycolytic pathways. So therefore what happens is glucose right after an injury can lead to actual long-term free radical damage. So don't give kids Gatorade, not a good thing. Okay, you want to make sure you're getting enough water. You want to make sure also that we're focusing more on protein for the first week or so. Now, when I just said giving water, that's after the first couple days. We don't want to load up on a lot of water initially. So if we can, fasting in the first 48 hours will help to clean out the debris. Are we going to totally fast? No, but limit the amount of food as possible. After day 5, slowly start introducing carbohydrates. Okay. Still eliminate gluten because that's an inflammatory type of carbohydrate, but you can introduce some others, some rice, and some other types of complex carbohydrates. You want to control the electrolytes, and you want to decrease sodium so that the cells don't expand. Okay, so as these cells are going to expand, that's also going to cause some crowding in the brain and some problems. So we also have what's called the next impact. Now, if we have another thing called second impact, which is where you actually have one concussion and then you get another successive concussive blow right after that, like a really hard concussion, then that could be incompatible with life. That has happened where people have died having a second concussive blow very recently after the first one. But we also have what's called the next impact. So the next impact is following a concussive force. So you can have a concussion and then you can just kind of tap your head or get your neck moving the wrong way where you didn't have a full-blown concussive force. But what it does is it takes half the force and twice as long to heal. So as that blood-brain barrier is open, now it took a smaller amount of force to cause the concussion to reoccur, and it's taking twice as long to heal. And this continues to go exponentially without incidence. So what ends up happening is eventually these microglial cells can keep going without even having any head trauma. So essentially what's happening is you're chemically reconcussing without having an actual force. So nutrition is extremely important. We want to look at things like fish oils, essential fatty acids, EPA, DHA, magnesium glycinate, vitamin D3, things like curcumin, which is from turmeric, resveratrol, glutathione, nitrobalax, which is a vasodilator, and things like green tea. So a lot of these, don't just go and take these. These are some of the things we might use. The main purpose is because they do have their specific principles and their properties. Some of them are vasodilators to allow more blood flow. Others are anti-inflammatories, natural anti-inflammatories to decrease inflammation globally. And others will address different issues such as antioxidants. But don't just go and take these things. These are just an example of some of the nutritional products we may use. So the other things we want to do is we want to increase oxygen to the brain. Your brain needs two things to survive. It needs fuel and oxygen. Okay? The third thing that it needs is activation. So fuel and activation. Okay? So fuel comes in the form of glucose and oxygen. And activation comes in the form of movement. So when somebody is coming into the clinic and they're treated for a head problem, we want to make sure that we're getting them those things, that we're getting fuel and activation going to the brain. Okay, a paleo diet. As of right now, there's research of more diets coming out all the time, but a paleo diet is the easiest thing to follow because it eliminates gluten, dairy, and soy. So gluten, dairy, and soy are the three most inflammatory types of foods to the brain, along with corn and sugar. So if you can eliminate gluten, dairy, and soy and go on a paleo diet, it's much easier to follow that. So for these types of injuries, it's a good diet to follow. So you want to decrease the amount of carbohydrates and glucose, and you want to increase your protein. This is the reason for the recommendation of a paleo type of diet. So after you've had an injury, you want to make sure there are no cell phones, no video games, no noxious smells. You don't want to be exposed to any aspartate, so no monosodium glutamate. Don't go and eat a bunch of Chinese food. The liver cannot process these toxins. Okay, so if you're going out after having a concussion and getting a bunch of Chinese food with a bunch of Diet Coke, not the best thing you can do. Okay, no lights. Get 10 to 12 hours of sleep, and please limit the exposure to loud noises. So some general time frames post-concussion. 2 weeks post-concussion, you should be healed, assuming there are no other problems, there are no other outlying issues that are going on there. 4 weeks post-concussion, you should be ready to go 100%. Okay. Now, when we're looking at sports specifically, 1 week post-concussion, there should be no practice. Okay, these athletes should not be going to practice. 2 weeks after a concussion, they should have no contact. So if they're playing hockey or football, they can go back to practice, but no contact. 3 weeks, they can actually return to play. So this means that they can go back in limited quantities, so going back and doing some practice, but no contact. And then 4 weeks post-concussion, that's when they can return to play, assuming that they have seen a medical professional, have been cleared to play, and that there are no residual effects. This is all barring complicating factors. So if there's no complicating factors, keep in mind this is a guideline. All diagnosis of a concussion must be made by a medical doctor here in the province of Quebec. Okay? Therapies and testing. So what are some of the things we're going to do here? Well, we do food sensitivity testing. We may look at MTHFR, which is methylene tetrahydrofolate reductase. This is looking at methylation. You can actually watch our video on methylation and see why that is important. Autoimmune testing, adrenal testing, nutrient deficiency testing. We may want to look at things like neurotransmitters. So your neurotransmitters like GABA, serotonin, acetylcholine, epinephrine, norepinephrine, are these being released and utilized properly? Diet, nutrition, vitamins, supplementation, and nutraceuticals. These are some of the things that we are going to do here, along with brain-based therapy. So some of these brain-based therapies, and what do I mean by brain-based therapies? Well, the thing that separates us here from a lot of other places is that we're not just looking at the brain globally. We're not just saying, okay, you've had a concussion and now we're just going to wait for that brain to heal. What we're trying to do is we're trying to localize what part of the brain was actually affected. So which part of the brain is being compromised from this injury? Is it the temporal lobe? Is it the prefrontal cortex? Is it your mesencephalon? Is it your thalamus? Is it your spinal cord? Where is it? Where is this problem? And then we come up with a specific plan in order to target that area with specific brain-based therapies. So those therapies might include things like spin therapy with fixation, eye lights, metronome therapy, optokinetic tape, looking at center of pressure, auditory visual stimulation, saccades or anti-saccades, nonlinear complex movements, warm calorics, neurofeedback, neurotracker. These are all different things we may use in the treatment or support of somebody that may be suffering from a concussion. Everybody is different, but we have to evaluate you in order to determine what part of the brain is being affected in order to come up with a specific plan. So what do you do next? Well, if you want to know more, give us a call, come in for an evaluation, and we will be glad to talk to you a little bit more about your condition. So give us a call at area code 514-426-6449. Once again, thank you for watching. My name is Dr. Aubrey Tager, and I hope you have a great day. Thanks. Bye-bye.